Senator Mullin.
Thank you, Chairman. I'm just going to make an open comment here. I kind of feel like hell's freezing over because Chairman Sanders and I actually agree on something, and it's that something needs to be done with PBMs. So I do appreciate you having this hearing in the order that we're having it, Chairman. That's actually a compliment coming from my side, if you can believe that. I want to point out this chart behind me. This is the integration chart where it starts showing how PBMs have integrated themselves and they've become their own customer, which is kind of like the fox guarding the hen house. And it's difficult when you start thinking about that Congress was actually wanted to help stand up the PBMs to help bring down cost. You've seen costs do nothing but skyrocket on prescription drugs. At the same time, you've seen that PBMs have become literally $1 billion industry. In the last 5 years alone, you've seen prescription drugs increase by 16%. At the same time, you've seen the net income of PBMs and their integrated companies grow substantially. Start thinking why. I mean, if the $1 billion industry has grown up, it's not because of taxpayer dollars. It's because it's got to be going to the drug cost. And if it's going to the drug cost, who's ultimately paying that price? Well, it's the consumer. Obviously, the money's got to be passed on to someplace. It's just retail politics, and it's retail consumers. The price has to be made up because every one of you guys are in business for profit, and I think that's great. That's called America. We're able to do that. But I want to kind of bring down on some things that need to be clarified. For instance, when Senator Marshall was asking the question of why is it that some drugs aren't able to make it to the market, and I believe it was said that they are if they're the lowest cost. But Mr. Hudson, when that comment was being made, you were shaking your head saying, because what Senator Marshall was asking is what prohibits drugs from coming to the market, especially competitive drugs, because everybody says competitiveness is what brings down the price, and I agree with that. But I don't think you actually agreed with, is it Joyner? With Mr. Joyner's answer when he said it's based on formula, whichever is the cheapest for the consumer. And as I was noticing, just reading your body language, you was going like this. Can you explain more from your perspective what prohibits drugs from coming to the market?
Yeah, I think what I was perhaps reflecting was a lack of unknown. Because, as I said, in 2018, we launched a lower price Admelog, in the insulin market. Last year, a lower price direct equivalent made in the same factory. And, you would expect if price was the answer, and perhaps we talk at slightly different terms, the use of cost versus price, I'm not quite sure what it means on both sides, but I'm reflecting on the fact that if the intent of the chair and everybody here is to lower the price of medicines, and we do, and it doesn't change for patients, I don't know why that is.
You brought a generic to the market, and that was significantly cheaper than the other one, but it didn't reflect the patient's payment?
It just didn't get listed in anywhere. If price is really the motivator, it would have been
interesting. And who prevented that from being listed?
I was not part of that conversation.
But the PBMs are the ones that helped bring that to market, right?
Well, my assumption is
your assumption?
The PBM.
I think you're being very politically polite here, and I appreciate that. But I think we can all read between the lines on this one. Mr. Ricks, when you're talking about rebate checks, because the comments were made earlier, because the question was asked about rebates, and our PBM officials over here, they were saying that the PBMs go to their customers, which I'm curious of who the customers are, because I think the public would assume that it goes to the public, to the individual, to the person buying the drugs. But I know I have 6 kids that seem to always be in the emergency room, that always seems to be getting prescription drugs of something, and I've never got a rebate check. So who's the customers? Where do you send your rebate checks to?
Yeah, thanks for the question. We send them to the PBMs, as mentioned.
But where does the check actually get mailed to? Does it get mailed to someplace inside the United States?
Well, we were instructed to send them to the GPO.
Where's the GPO at?
I think it was asked earlier, the various organizations you have up there.
But most of your checks, what country are they mailed to?
Well,
Outside the United States, or
there are some that go outside the United States.
in the tune of how much, would you, give me a guess?
Our total rebates in the United States for commercial that was paid to the major three last year was $8 billion.
Okay.
It's not a third, but it's roughly that.
And a big chunk of that goes outside the United States?
Several billion.
Goes outside the United States, but yet these are customers for inside the United States.
Yes,
Right. These are
correct.
rebates for
For
customers.
U.S., access to U.S. formularies, yes.
But yet the rebate checks aren't actually staying inside the United States, the biggest chunk of them.
Correct, or a big chunk.
That's
yes.
interesting. That's interesting too. I wonder why that is. And so when we start talking about customers for the PBMs, who are your customers that you're referring to that the rebates go to? Because you say the PBMs only keep 90, 97, 98, or you guys send out 97, 98% of your rebates, right? And the customers is the insurance companies, right?
So, Senator, our customers, so Express Scripts has over 2,500 customers.
But
Many
for-
of them are employers, small, middle market employers, some large employers. Labor unions are our clients,
So
public
self-
sector
so self-employed
entities,
or self-insured.
and health plans.
And health plans, right?
Yes,
But also your-
self-insured, yes.
But also your insurance companies, right? Then the whole reason is to supposedly bring down premiums. But yet, if you look at this top line here where it says insure, the PBMs own the insurance companies that their rebates are going to. It's self-integrated. So you're rebating yourself. That is just, wow, great business model. And we wonder why prices are high to our consumers. And this is why the chairman and I actually agree on something. This isn't working for America. It's working for you all great. I mean, you guys are killing it. But if we're talking about bringing down prices, what have you all done to bring down prices? That was the whole reason why you guys were created, to bring down prices. And we've seen nothing but them increase. It's not going to the pharmaceutical companies that are making it. It's not going to the pharmacists unless you own them. But if you own them, we really don't care if it makes it, because upstream or downstream, depending on where they are in the integration chart, that's where you're getting your money back. And you wonder why you're here? Are you actually serving your purpose? Heck no. You're not. And as I said before, it's like the fox guarding the hen house. You've literally forced us to make the changes. And in my private company, if I have an entity that's not being effective for what their intended purpose is, I would shut them down. And that's what I think the solution here is. With that, I yield back.